This is a recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 20th November 2024. The candidate's name is Mirgam and the candidate number is 2843. The interlocutor is Sangeeta Gopi and the interlocutor number is 9263. This is role play number 1 for the profession of nursing. Good afternoon, Mirgam.
Good afternoon, ma'am.
May I see your identification, please?
Yes, sure, ma'am. Here it is.
Okay. Okay. All right. Thank you. Now, Mirgam, remember, this is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. We will first move on to a warm-up session to get you started.
Okay, ma'am.
This is not in any way assessed. Are you ready?
Yes, ma'am.
Okay. So my first question is, where are you from and can you describe your hometown?
Yes, sure, ma'am. I am from Arunachal Pradesh, a small district of Vetsian district, and it is also known as the land of rising sun, and it is nowadays most popular for the tourism, and the foods and culture, it is very different from other states.
All right. And Mirgam, why did you choose this profession of nursing?
I chose nursing as my profession because of numerous reasons. So first of all, it is my childhood dream to become a nurse. Beside my elder sister, she is also a nurse, and her story inspired me a lot to choose nursing as my profession.
And what are your future plans?
Yeah, it is a quite interesting question, ma'am. So after clearing this OET exam, I will move on abroad, and I will take experience in the clinical side, and after that I am planning for my further studies.
Great. So that's the end of the warm-up session.
Okay.
Now we'll move on to the role play.
Okay.
I'll be taking the part of the patient or the bystander, and you will take your professional role, which is that of a nurse. The role play will last a total of 5 minutes, and you will be given 3 minutes to prepare for the same. Remember, the role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions so
No,
far?
ma'am.
All right. Right. So here is your role play card. The setting is a local clinic. Here is a pencil for you to work with. You have 3 minutes to prepare. You can make notes on the role play card, and if you wish, yes, you can make these notes. Remember, you can look at the card during the test, but you must return it to me at the end of the test.
Okay.
Are you ready?
Yes, ma'am.
Okay, so your preparation time starts now. Alright, Mirgam, so that's the end of your preparation time.
Okay.
You now have a full 5 minutes for your role play. Don't worry if I stop you, that would just mean it's the end of your time.
Okay.
Are you ready?
Yes, ma'am.
Alright, you can begin now.
Good morning, John.
Good morning.
Nice to see you here again.
Thank you.
So you are here for your wound dressing change, am I right?
That's right.
Okay. So how you are coping these many days?
Oh well, about the boils, I think I'm doing well.
Okay.
And you know, yes, like you said, I'm here to change the dress, but I have a big concern.
Okay. So may I know the concern?
Yeah, I've had you know, some loose stool problems.
Okay.
I think you call it diarrhea. And it was there for the first 3 days.
Okay.
4 or 5 times a day.
Okay.
I haven't tried any treatment for it.
Okay.
I thought it would, subside and it would
Okay.
get sorted, but nothing.
Okay, well, John, I'm sorry to hear that you are experiencing this diarrhea.
Right.
But don't worry, we will discuss the causes and treatment for that. But before moving further, may I ask you some questions regarding your condition?
Oh, yes, please.
Okay, so as you mentioned that you are having diarrhea, apart from this, did you notice any symptom? Like stomach pain, vomiting, fever or headache?
Oh, surprisingly, no, none of these. I haven't had any of these problems.
Okay, that's a good thing. You are not having this type of symptom.
Right.
And to know more detail regarding your condition, I just want to know about your medical history. So, do you have any medical condition?
No, I don't have any other problems.
Okay. Any long-term medication, or currently you are taking any medication?
Currently, yes. After the boil,
Okay.
From here I was given some medications. I don't know which ones they are, but yeah, I'm taking some medicines.
Okay. And what about your diet? Any recent changes?
No. I still have my rice and vegetables. I think the doctor did not ask me to change my diet.
Okay.
So I've been following the same.
Okay. And are you allergic to any medication or foods?
Oh no, thankfully no.
Okay.
None yet.
Okay. And what about your fluid intake in a day? How many amount of fluid you are drinking?
I drink a couple of glasses, like 7 to 8 glasses. I think it might be around a liter of water a day.
Okay. And what about like coffee and alcohol?
Well, not alcohol, but I love to have my morning cup of coffee. I never miss that. So yes, a cup of coffee a day.
Okay, thank you, John, for providing me this information. It is really important for me to know in detail regarding your condition.
Right.
But as you mentioned that currently you are taking some medication.
Right.
So is it antibiotics?
I think so. It might be the antibiotics that you've mentioned.
Okay.
And yes, also some painkillers. I think it's paracetamol the doctor had given me.
Okay. So see, John, I come to know that because of this antibiotic, this might be the causes of your diarrhea.
Oh, is it?
Yes.
Okay, that means I should stop taking my antibiotics.
No, John. See, I will explain in detail regarding that. So see, why you are because of this antibiotic, your body is react towards the medication, and there might be some changes in your digest of the food, and it might be the resulting of changes in your bowel movement.
Okay.
So are you getting my points?
Yes, what I've understood from what you said is that antibiotics is causing all of this. So am I right when I say I should be stopping antibiotics?
Yes, I was coming to that point, John. So see, I strongly suggest you to continue your antibiotic dose as prescribed by your physician, because it will prevent you from infection, and it will also decrease the amount of infection in your infected area.
Okay, but then you told me it is the antibiotics which is actually causing this diarrhea.
Yes, I said like that, but see, for that I would like to add some more information regarding for that. So please, so for I would like to recommend you some treatment for that to prevent from diarrhea. So take some, as you mentioned that you are taking some painkiller, paracetamol. You can take continuously if you will have some pain in your abdomen. And apart from this, you can also add some probiotic medication. It will prevent you from the diarrhea. So it will interact with the antibiotic and and it will prevent from diarrhea. And it is most important thing is, as you mentioned that you are taking plenty of fluid, so please continue to take this water, because you are losing your foods and energy through the stool.
Thank you, Mirgam. That's the end of your time. You may now return the card to me.
Sorry ma'am, I reacted something.
No problem.
Medcity International Academy. Trusted hands forever.